Okay, let's dive in. We're tackling a huge health issue today, one that often flies under the radar. Non-alcoholic fatty liver disease. You hear estimates, what, 20, maybe 30% of people in Western countries?
That's right. And it's so linked to metabolic problems now that many are calling it Metabolic-Associated Fatty Liver Disease, or MAFLD.
MAFLD. Yeah, that name really shifts the focus, doesn't it? Makes it clear it's part of a bigger picture.
Exactly. It underscores that this isn't, just a liver problem in isolation. It's systemic, tied tightly to things like diabetes, heart disease risk.
Right. And the main treatment, it's not a pill, is it?
For the vast majority, no. The established primary approach is, well, significant lifestyle changes.
So that's our mission for this deep dive then. We need to get beyond just saying eat better, move more. We've got data, right? The specifics on what actually works best for liver health.
Precisely. We want to sift through recent findings, compare different approaches, and figure out the most effective strategies for you listening.
Okay, where's the starting point? What's foundational?
It really has to start with weight loss. The research is incredibly clear on this. There's a direct dose-response relationship.
Dose response, meaning the more weight you lose, the better the liver gets.
Exactly. More weight reduction leads to greater histological improvement, actual measurable healing in the liver tissue itself. And it's not just about liver fat. Losing weight also tackles those related cardiovascular and diabetes risks.
Okay, so let's talk numbers. If someone's thinking, what's the minimum I need to do to see some benefit? What's that first target?
The science suggests a few tiers. Tier 1, the sort of modest but still important goal, is losing at least 5% of your initial body weight.
5%. And that helps with?
That starts to reduce the steatosis, the actual fat buildup in the liver. It gets the ball rolling on improving health markers.
Got it. 5% is the entry point. But what if you need more serious results, like really pushing back the disease progression?
Then you need to aim higher. For what we'd call clinically meaningful regression of the disease, you're looking at losing at least 7% of your initial body weight.
7%. Okay, getting tougher.
And then there's the big one. For near universal resolution of NASH, that's the more severe form, non-alcoholic steatohepatitis with inflammation.
Right, the inflammation and scarring.
Yes. And to see improvement in fibrosis, the actual scarring, you need significant weight loss. The benchmark there is tough.
Yeah.
At least 10% of your initial body weight.
10%. That's a lot. But knowing that target could potentially reverse fibrosis, well, that's a powerful motivator.
It really is. It gives people a concrete goal, moving beyond just reducing fat to actually healing the liver structure.
Okay, so hitting that 7 to 10% range is key. But how you lose the weight? Does the method matter? Calorie cutting is calorie cutting, right? Or maybe not.
Well, that's the million-dollar question, isn't it? And we look at a really interesting recent randomized controlled trial, just 12 weeks long, that directly compared two popular methods.
Oh, okay. Which ones?
Standard everyday calorie restriction, let's call it CR, versus the 5.2 intermittent fasting, or IF, diet. The 5.2. Let's quickly define those. The daily CR group, what their intake looked like.
Pretty standard stuff. For women, it was about 1,200 to 1,500 kilocalories a day. For men, a bit higher, 1,500 to 1,800. Just a consistent deficit.
Okay, straightforward enough. And the 5.2 group, that's different.
Very different structure. They ate their usual amount 5 days a week.
Like normal maintenance calories?
Basically, yes. Maybe around 1,400, 1,600 for women as an example in the study, kind of customary eating. But then on 2 non-consecutive days each week, they did a light fast.
Light fast meaning really low calorie.
Yeah, significantly restricted. Down to 600 kilocalories for women on those days, 800 for men.
Okay, so 5 normal days, 2 very low cal days. What happened after 12 weeks?
This is where it got really interesting. Both groups lost similar amounts of weight. Their liver enzymes improved similarly, lipid profiles, blood sugar control, pretty much neck and neck on those standard measures.
Okay, so maybe the method doesn't matter that much.
But here's the twist. The 5.2 IF group showed better improvement in fibrosis and steatosis scores.
Wait, better liver improvement, even though they lost the same amount of weight?
Exactly. The improvements seem to be happening independently of the weight loss itself.
How is that possible? If the weight loss is the same, what's the IF doing extra?
The thinking is it's about the metabolic switching. Going back and forth between fasting and feeding states does something unique.
Like flipping a switch in the body.
Sort of. During the fast, the liver shifts gears. It moves away from using glucose and starts burning fatty acids and producing ketones for fuel.
Right, ketosis.
Yes. And this promotes using up stored fat. Plus, Ketones themselves aren't just fuel, they seem to act as signaling molecules, potentially protecting organs and making them more resilient to stress. You're essentially forcing a metabolic cleanup.
That's fascinating.
Yeah.
The timing of the calories, not just the amount, has a distinct liver benefit. I bet a lot of people will find that compelling.
It's definitely a point in favor of exploring time-restricted patterns.
Were there any downsides noted for the 5.2 approach in this trial? Or anything where the daily restriction performed better?
Yes, there was an important difference regarding inflammation. The daily CR group actually had a superior reduction in a key inflammatory marker called HSCRP.
HSCRP, high sensitivity C-reactive protein.
That's the one. It's a general marker of low-grade systemic inflammation. So while 5.2 IF looked better for liver structure, maybe daily CR was slightly better at calming down overall body inflammation.
Interesting trade-off. And what about side effects, like just feeling hungry or tired?
Both groups reported those, which is pretty typical when restricting calories. Maybe slightly more pronounced in the 5.2 group, specifically on their fasting days, as you'd expect.
Okay, makes sense. So timing matters, but maybe has slightly different effects on different systems. Let's pivot now from when to what? Diet composition. The Mediterranean diet comes up constantly for NAFLD. Why is that pattern so recommended?
It really hits the sweet spot compositionally. It typically involves reducing overall carbohydrate intake, aiming for maybe around 40% of calories.
And especially cutting back on the processed stuff, sugars, refined grains.
Absolutely key. And then crucially, it increases the intake of healthier fats, monounsaturated fats like olive oil and omega-3s from fish, often bringing fat intake also to around 40% of calories. It's about the quality of the carbs and fats.
And here's something else that stood out from the sources. The Mediterranean diet might help the liver, even if someone doesn't lose a lot of weight.
That's probably the second huge takeaway. Yes, studies suggest the compositional benefits, the anti-inflammatory effects of those good fats, the metabolic effects of lower sugar can reduce liver fat even without hitting those big 7 or 10% weight loss numbers.
So changing what you eat has direct liver benefits, separate from just the calorie reduction.
Precisely. The improved nutrient profile seems to directly target the inflammation and metabolic dysfunction in the liver.
Okay, let's drill down into the macronutrients then. If eating too many calories of anything is bad, is there a specific bad guy when it comes to liver fat? Sugar versus fat.
Well, first off, hypercaloric diets, eating more calories than you burn, consistently increase liver fat. Doesn't matter much if the excess comes from fat, sugar, or both. Too many calories equals more liver fat.
Right. Surplus is surplus.
But sugar, especially fructose, seems particularly problematic for the liver.
Fructose. Why is that one so bad? How does it cause trouble?
Okay, think of glucose metabolism like traffic going into a city. There's a main checkpoint, a rate-limiting step, that controls the flow.
Got it.
Fructose, though, kind of takes a bypass route. It skips that main checkpoint and floods directly into the liver's fat-making pathways.
So it gives the liver too much raw material too quickly.
Exactly. It provides abundant substrate for de novo lipogenesis DNL, which is just the fancy term for the liver creating new fat from scratch.
That explains why sugary drinks are such a disaster. I remember seeing that Framingham Heart study data people drinking them daily had something like a 61% higher risk of fatty liver.
Yes, the link is very strong. Liquid sugar is particularly easy to overconsume and hits the liver fast.
But we shouldn't just blame sugar, right?
Right.
What about fat? Specifically saturated fat.
Good point. We can't let saturated fat off the hook. Some short-term studies where people were deliberately overfed found that diets high in saturated fat actually increased liver fat more than diets high in excess fructose or even polyunsaturated fat.
More than fructose, wow.
Suggests that when consumed in excess, saturated fat might be particularly harmful to the liver.
Okay, so limit excess calories overall, be extra careful with fructose, especially liquid sugar, and watch the saturated fat intake. What about protein? I saw something surprising there.
Yeah, that was an interesting finding. It seems adding high protein intake or even specific essential amino acids might offer some protection.
Protection how? Even if the diet is otherwise high in fat or sugar.
It appears so. Some studies suggest higher protein can significantly attenuate or lessen liver fat accumulation even in the face of those hypercaloric high fat or high fructose conditions.
Like protein runs interference somehow.
It might help stabilize the metabolic environment, perhaps shifting how the excess energy is processed or stored. It's an intriguing area.
Okay, so we've covered diet timing and diet composition. What about movement? If someone is really struggling to stick with dietary changes, can exercise alone make a dent in liver fat?
Absolutely. This is crucial. Physical activity provides benefits that are independent of weight loss.
Independent, meaning even if the scale doesn't budge.
Yes. Studies show that structured exercise, even without any dietary changes, can lead to about a 20 to 30% relative reduction in liver fat.
20 to 30% just from exercise. That's significant.
It is. Now, it's not the 80% or more reduction you might see with massive weight loss, but it's definitely a clinically meaningful improvement.
How does exercise do that? What's the mechanism for cleaning up liver fat?
It works in a couple of main ways. First, exercise improves peripheral insulin sensitivity, makes your muscles and other tissues better at taking up glucose.
Which takes the pressure off the liver.
Exactly. Less insulin resistance means less signal for the liver to produce fat via that DNL pathway we mentioned. Second, exercise seems to increase the clearance of VLDL particles.
VLDL, very low density lipoprotein. What are those again?
Think of them as the liver's fat export trucks. The liver packages up fat into these VLDL particles to send it out into the body. Exercise helps clear these trucks out of the bloodstream more efficiently so fat doesn't just sit around in the liver.
Got it. So exercise helps on both the production and the export side of liver fat. Now, there was another important point about activity, that being sedentary is different from just not exercising enough.
Yes, a really vital distinction. They aren't just opposites. Sedentary behavior like prolonged sitting, watching TV has independent negative effects, even if you meet exercise guidelines.
So you could go to the gym for an hour, but still be at higher risk if you sit for the other 10 hours of the day.
Precisely. Researchers talk about a triple-hit behavioral phenotype for high NAFLD risk. It's the dangerous combination of 1, poor diet, 2, low overall physical activity, and 3, high sedentary time.
The triple hit. Okay, so breaking up long periods of sitting is important too, not just dedicated workouts.
Definitely. Just getting up and moving around more throughout the day matters. Your total sedentary time is an independent risk factor.
This all makes sense, but we know these lifestyle changes are hard to stick with long term. Weight regain is common, right? What helps people maintain progress?
It's the biggest challenge. Weight regain often starts creeping back after about 6 months. So the focus really has to shift towards sustainable behavioral support. It's not just about the initial push.
So ongoing help.
Yes, clinicians are encouraged to use frameworks like the 5 A's model.
The 5 A's.
Ask, advise, assess, assist, and arrange. It's a structured way to check in, provide tailored advice, understand the patient's readiness and barriers, help them problem solve, and arrange follow-up. It's about building long-term habits.
Makes sense. Consistent support for a consistent effort. Okay, this has been incredibly informative. If we boil it all down, what's the core message for someone listening who's dealing with MAFLD or trying to prevent it?
I think the foundational truth holds. Getting that 7% to 10% weight loss gives you the best shot at profound liver disease reversal, especially fibrosis. That's the gold standard outcome.
But it's not all or nothing.
Absolutely not. If that 10% feels overwhelming right now, don't despair. You have other powerful tools. Adopting specific dietary patterns like the Mediterranean diet, maybe trying a time-restricted approach like 5.2 if it suits you, and crucially, incorporating regular physical activity and reducing sedentary time. All of these provide significant independent benefits.
So they help heal the liver metabolically and structurally, even if the weight loss isn't dramatic.
Yes. You're still improving liver health, reducing inflammation, improving insulin sensitivity. You're chipping away at the problem from multiple angles.
That focus on the underlying metabolic health, not just the number on the scale, seems key. That links to that final, really provocative point we found in the long-term data, doesn't it?
It really does. Those follow-up studies were fascinating. They found that even when people regained some weight after their initial intensive diet phase ended,
Yeah.
the improvements in their liver fat and their insulin resistance often persisted, sometimes for up to 2 years later.
Wow. So the liver stayed healthier, even when some pounds came back on.
It suggests that achieving that initial deep metabolic shift might create lasting internal changes.
It really makes you question the focus, right?
It raises a huge question. Should our primary goal be obsessively maintaining a specific, potentially hard-to-sustain weight, or should it be achieving that profound metabolic reset, that sustained improvement in how the body functions, even if the scale fluctuates a bit afterwards?
Maybe that internal metabolic health is the real long-term win.
Perhaps. It's definitely something to think about, shifting focus from scale anxiety to achieving and maintaining that deeper metabolic resilience.
A powerful thought to leave our listeners with. Thank you. This has been incredibly insightful.
My pleasure. It's crucial information to get out there.